Hello, everyone, and welcome to today's webinar, Acquired Brain Injury, Occupational Therapy Assessment and Intervention. This is a new healthcare services community support initiative supporting carers of people with an acquired brain injury. My name is Laura Conway. I'm the Occupational Therapy Manager with New Healthcare, and I'll be presenting today's webinar. In today's webinar, Acquired Brain Injury, Occupational Therapy Assessment and Intervention. The module has been designed to provide helpful information in relation to the role of the occupational therapist in supporting a person with an acquired brain injury and the scope of occupational therapy assessment and intervention. The course is suitable for all caregivers and family members who wish to gain a greater understanding of occupational therapy and how occupational therapy can assist persons with an acquired brain injury. In today's webinar, we'll cover a series of topics. I'll firstly introduce acquired brain injury. I'll then explain the role of the occupational therapist in supporting individuals who experience an acquired brain injury. I'll also explain some common occupational therapy assessment and intervention approaches when working with individuals with an acquired brain injury. I'll present on 2 case study examples and before summarising today's learnings. Topic 1, acquired brain injury and introduction. Acquired brain injury definition. An acquired brain injury is sometimes referred to as an ABI, and it's any injury to a person's brain that happens during their lifetime. The injury can be caused by a stroke, a bleed in the brain, an infection, a tumour, a lack of oxygen, or a fall, for example. An acquired brain injury is not hereditary, meaning that it does not pass from parent to child. It is not congenital, meaning it is not present from birth, and it is not degenerative over time. Acquired brain injury prevalence. So statistics from the Acquired Brain Injury Ireland estimate that there are 19,000 new brain injuries annually in Ireland. There are 10,000 people hospitalised with a brain injury annually, and there are 120,000 people living in Ireland with disabilities post a brain injury. The main causes of acquired brain injuries include stroke, which accounts for 50% of all acquired brain injuries, falls at 11%, tumours at 10%, road traffic accidents at 9%, and assault at 5%. In terms of the effects of an acquired brain injury, it's important to know that the brain is the powerhouse of the body, meaning that it oversees the entire workings of the body, even though it only makes up 2% of the body's overall weight. The effects of a brain injury is dependent on the part or parts of the brain affected, and it'll differ from each person, ranging from mild to profound. But the more severe the brain injury, the greater the residual effects and the greater the impact on day-to-day functioning. Here are some specific effects of an acquired brain injury. So motor effects include weakness or paralysis on one side of the body, also known as hemiplegia, poor balance and coordination, which is also known as ataxia, reduced endurance, abnormal muscle tone, and stiffness. Cognitive impairments include problems with short-term memory, slower learning and limitations in learning, and difficulty with retrieval of long-term memory. In addition, individuals who experience an ABI may experience impairments in thinking, reasoning, paying attention or concentrating on a task, may display poor judgment and poor problem-solving skills. In terms of sensory and perceptual problems, individuals experiencing a brain injury may have difficulties with hearing, their vision, their taste, smell, touch, and knowing the relationship of the body to fixed objects. In relation to communication and language impairments, they may experience difficulty understanding speech and difficulty in expressing thought. This is also known as aphasia. And individuals who experience an acquired brain injury may experience regulatory or emotional changes. So they may become easily frustrated, they may experience anxiety, they may become impatient, angry, depressed, or experience low self-esteem. Topic 2, the role of the occupational therapist. An introduction to occupational therapy. So occupational therapy, it's a client-centered health profession concerned with promoting health and well-being through engagement in occupation. Occupational therapists categorize everyday occupation into the following three areas: self-care, work, and leisure. Self-care is everything one does to look after themselves. It includes getting washed in the morning, getting dressed or undressed, brushing teeth and brushing hair, and managing medication. Work is everything one does to be productive. This could be paid or unpaid work. It could be college or school activities, and it could also be domestic tasks in the home. And leisure is everything one does to enjoy life and be with others, such as participating in hobbies and interests. Occupational therapy is an essential step on the road to recovery after an acquired brain injury. Individuals who lose the capacity to perform day to day tasks, such as the ability to maintain balance, concentrate on a task, retain information, and even reach for an object, require the expertise of an occupational therapist. Through setting realistic and achievable goals, the occupational therapist and the person will work together through a rehabilitation plan towards achieving the highest level of independence and ability possible for that person. This slide provides an overview of the occupational therapy process when working with an individual who experiences an ABI. The first stage in the process is the referral stage, which outlines the reason or the need for occupational therapy input. Next is the information gathering stage before engaging the individual in standardized and non standardized assessment. Problem formulation stage is, I suppose, a collation of the findings from the assessment to identify the person's strengths and their difficulties in respect of their day to day functioning. The goal setting stage then is a collaborative process between the occupational therapist and the person. And it's really, really important that this is collaborative because then it's meaningful to the person. Next is the intervention plan. The intervention plan is developed based on the goals that have been set with the person. And the next stage in the process is the intervention process, which is the treatment or the actual engaging the individual in rehabilitation. Next is the outcome measurement stage, and outcome measurement or the outcome measure stage looks at the effectiveness of the treatment program. And the discharge stage is when the individual will have hopefully achieved the goals that have been set out as part of their rehabilitation program. Topic 3, occupational therapy assessment. Occupational therapy assessment, it generally will be in person. The location does depend on where the person is at in terms of his or her rehabilitation and the reason for referral to an occupational therapist. So occupational therapy may occur in a hospital setting. It might occur in the community. It might occur in a school or a home setting, the workplace, or a dedicated clinic space. Occupational therapists put particular focus on assessing individuals' strengths and their difficulties pertaining to their motor, cognitive, perceptual, and interpersonal functioning, and how their current level of functioning and the environment around them supports or inhibits their engagement in their desired self care, leisure, and productive occupations. In terms of assessment, there's many assessments from which an occupational therapist might choose. It generally involves a mixture of observational and performance-based assessment of individuals in their specific day-to-day tasks. And it might also include tabletop standardized and non-standardized assessments. Quite often, the same assessments will be re-administered at the end or during the intervention during the in the intervention stage, and that's to monitor progress and the effects of treatment. And occupational therapists, they commonly involve the other members of the multidisciplinary team in the assessment process. That might include a physiotherapist, a speech and language therapist, a psychologist, or a nurse, for example. Topic 4, occupational therapy intervention. Depending on the person's potential for recovery, occupational therapy will quite often focus on enhancing performance in occupations important to the person. This is achieved through a variety of approaches, and we generally categorize them into four different approaches. That is to create or promote function, establish or restore, maintain function, or modify function. In relation to creating and promoting, this approach is designed to provide enriched, contextual, and activity experiences that will enhance performance, and that might include developing and implementing a fatigue management program for a person post ABI. In terms of establishing and restoring, this approach is designed to restore a skill or ability that has been impaired as a result of the ABI. So that might be improving the person's hand function so that they can load the washing machine for laundry tasks, for example. To maintain function, or the maintain approach, this is designed to provide supports that will allow the person to preserve their performance capabilities that they have regained. So, such as supporting maintenance of safe and independent access for people with low vision by increasing hallway lighting in a community centre or in the person's home, for example. Or modify, this approach is directed at finding ways to revise the current context or the demands of an activity or a task to support performance in a natural setting. So, this might include simplifying a task. So, to help a person with a cognitive impairment complete a morning self care routine. Here are some additional common occupational therapy intervention examples. So, occupational therapists quite often might advise on memory strategies for individuals who experience short and long term memory challenges or difficulties. Occupational therapists might also advise on routine planning and motivation strategies, particularly as people who experience an ABI quite often present with low motivation and difficulty engaging in activities of interest. Occupational therapists might also advise on community access or promote community access support, and that to help the person to use supermarkets, the cinema, the gym, or public transport, for example. Occupational therapists might help with supporting the person to return to work, maybe to volunteering, to engaging in social activities, or engaging in sports and other hobbies. Occupational therapists might also advise on sleep hygiene and emotional regulation strategies. They might also recommend specialist equipment such as wheelchairs or beds or through floor lifts. They might also provide advice and education on moving and handling. They might also advise on home adaptations and complete housing assessments to support accessibility. They might provide education and training to carers and family members. Occupational therapists might also advise on techniques and activities to support independence in daily activities, such as washing and dressing and meal preparation, for example. An occupational therapist also carry out splinting to reduce tone, contractures, and enhance the functional positioning, particularly of the upper limb. Topic 5, case studies. So Jennifer, she's a 7-year-old girl. She's the middle of three children. She has an older brother. His name is Joseph and he's 16, and she's a younger sister, Susie, who's 2. Her primary carers are mom and dad. Mom stays at home and dad works as a manager of a national food company chain. Jennifer experienced a brain tumour which was removed in 2021. In terms of roles, Jennifer is a daughter, she's a sister, and she is a student. In relation to the environments she accesses, she lives in Cork. She accesses the locality, the Cork locality, her home and her school. In terms of social supports, her mum is originally from Zimbabwe, and all mother's family still live there. Her dad is originally from Cork, and his family live near, and support is available from granny and granddad, her 2 aunties, and 1 uncle. In terms of occupations, she attends mainstream school. Her favourite subject is art, and she also enjoys ballet and gymnastics and playing with her pets, Lily the cat and George the dog. In terms of performance, it's reported that Jennifer becomes easily distracted. She's got poor concentration skills. She has movement seeking behaviours. She becomes easily frustrated and has difficulty managing her emotions. In terms of assessments and findings, so three main assessments were carried out with Jennifer. That was the sensory profile 2, followed by the school companion sensory profile, and a personal care assessment was also undertaken. The findings were that Jennifer presented with difficulties in dressing and tying shoelaces and closing zips. She became overwhelmed and distracted by loud noises. She was understimulated by sensory input. She displayed poor posture at school and poor concentration. And she had difficulties with emotional regulation and maintaining relationships with peers, and she had frequent emotional outbursts. In terms of goals, in relation to the difficulty with dressing and tying shoelaces and zips, a goal was set whereby Jennifer will be able to dress herself daily with minimal assistance. In relation to being overwhelmed and distracted by loud noises, understimulated by sensory input, displaying poor posture at school and poor concentration, a goal was set to co-produce a school and home routine that supports Jennifer to meet her sensory processing needs. And this included the implementation of a visual planner at school and at home, introducing sensory breaks into her home and school environment, as well as the wobble cushion. In relation to difficulties with emotional regulation and maintaining relationships with peers, a goal was set to educate Jennifer, carers, and teachers on an emotional regulation toolkit and how to use this effectively to support Jennifer to recognise and manage emotions. The second case study is James. He's a 50-year-old male. His interests and hobbies include listening to country music. He's also a member of the local JA club. He enjoys camping with his children. He experienced a brain injury during a farm accident when driving a tractor. As a result, he became a wheelchair user post-accident. He had been admitted to the National Rehabilitation Hospital and was discharged home post-treatment with reduced mobility. James's main roles is that he's a husband, a father, a member of the JA Club, and he's also a farmer. In terms of the environments, James accesses his home, the local community, and his farm, which is located in a rural village in County Tipperary. In relation to James's occupations, he engages in the usual self-care, productive and leisure occupations associated with being a 50-year-old farmer. In relation to performance, it's reported that he presents with reduced mobility, he experiences fatigue that impacts his ability to complete activities. In terms of assessments and findings, the functional independence measure and a functional assessment measure was carried out with James. This is a global measure of disability and it is measured on a 7-point scale. A fatigue impact scale was also undertaken, as well as a workplace assessment and a quality of life measure. Findings were that he presented with needing moderate assistance for personal care activities due to fatigue, dominant hand weakness, and his impaired mobility. He also presented with difficulty returning to work due to safety concerns around falling, as well as impaired mobility and general functioning. And there was also a negative impact on his quality of life and overall well-being as a result of the brain injury. In terms of goals and interventions for James, goal 1 was to complete an upper and lower body dressing independently, and for James to shower with supervision only. Goal 2 was for James to be able to return to work on the family farm safely. Goal 3 was to adapt James's environment to an enabling one, and to provide aids and appliances to promote his independence, quality of life, and his overall well-being. In terms of interventions, a graded repetitive arm supplementary program was introduced. This is a self-directed program and it's aimed at improving arm and hand strength, as well as coordination and ability to use the affected arm in his daily activities. An energy conservation and fatigue management program was also introduced, along with environmental adaptations such as the removal of the bath, installation of a level access shower with drop-down shower seat, along with grab rails. And additional aids and appliances were also recommended, which included the recommendation for a quad bike to support his access to the local farm. Topic 6, summary. Today we went through some helpful information about acquired brain injury, how it occurs and its effects. We also learned about the role of the occupational therapist in supporting individuals with an acquired brain injury, and we explored types of assessment and intervention approaches. Lastly, we went through some case study examples to help you better understand how an occupational therapist might support individuals with an acquired brain injury. We hope you found today's webinar helpful and that you now have a greater understanding of how an occupational therapist can support an individual with an acquired brain injury. Thank you for your time and attention during today's webinar. We hope you found it helpful. Should you wish to add structure to your caregiver routine, please refer to the sample tools and third-party resources associated with this webinar, which have been conveniently uploaded to your learner area of your learning management system. Please keep in mind that these are only samples, and with your newly acquired knowledge, you might choose to use these in whole or in part, or research alternative resources and tools yourself. If you have any questions in relation to any of the topics or areas raised during today's webinar, please feel free to contact the clinical department by emailing clinicaldepartment@newahealthcare.ie.